Hello and welcome. Today we're going to talk about addiction crisis stabilization. So, the key objectives in stabilization services are to ensure immediate safety, quickly assess and address any life-threatening situations, implement medical interventions if necessary, such as administering Narcan for opioid overdoses, provide emotional support. Use de-escalation techniques to calm the individual, offer empathetic listening, and validate their experiences to build trust. Conduct a, conduct a needs assessment, utilize brief screening tools to evaluate risk factors, identify underlying issues contributing to the crisis, including co-occurring mental health conditions, and then develop a short-term plan. Create an immediate action plan for stabilization. Connect the individual to appropriate resources for ongoing support and treatment. So, common addiction crisis scenarios are substance-induced psychosis, and this presents with hallucinations, paranoia, or agitation. It requires careful management to ensure safety of the individual and others. Their severe withdrawal can lead to dangerous symptoms like delirium tremens or seizures, often requires medical supervision and supportive care. And then there's overdose incidents. They require immediate medical intervention to prevent fatal outcomes. May involve respiratory depression, loss of consciousness, or seizures. So, what is drug-induced psychosis? Methamphetamine can cause severe psychological effects. Meth-induced psychosis is a serious condition that can occur in people who use methamphetamine, even if they only use it occasionally. So, methamphetamine use can cause psychosis by interfering with the brain's neurotransmitters, particularly dopamine, which we've talked about a bit. Dopamine is a chemical messenger that plays a role in motivation, reward, and pleasure. Remember the hijacking of the reward system? Okay. When methamphetamine is taken, it causes a surge of dopamine in the brain, leading to feelings of euphoria and increased energy. However, prolonged use of methamphetamine can deplete the brain's dopamine stores, which can lead to symptoms of psychosis, such as hallucinations, paranoia, and delusions. Drug-induced psychosis can last for days, weeks, or even months, and in some cases, unfortunately, it can be chronic and be a lifelong problem. So let's watch this video on psychosis and drug-induced psychosis.
What causes psychosis? Is it biological, environmental? Can it be induced later on in life? I'm Mike, your pharmacist, and today on the Daily Dose, we will talk about what causes psychotic symptoms. So, what causes psychosis? Well, we're not entirely sure. It's hard to notice or test the symptoms of psychosis in animals or rats. It seems like psychotic symptoms are unique to humans. However, we do know the following two factors contribute to psychotic symptoms. Point one, the anatomy of the schizophrenic brain is different, and two, neurotransmitter dysfunction in the brain. Now, first and foremost, anatomic abnormalities. According to brain imaging tests, there are clear anatomical abnormalities in a schizophrenic brain. Unfortunately, these images can't be used to diagnose schizophrenia. It's just not that simple. So what we use is the DSM-5 criteria to diagnose schizophrenia. This is essentially a clinical interview and patient observation. It can be argued that this whole process is subjective in its nature. Now, the anatomy of a schizophrenic brain is different than the average person. The brain actually looks different. To illustrate this point, please look at this image. This image shows the brain of 28-year-old twins. The left depicts the average brain, and the right depicts a schizophrenic brain. This image highlights another 2 points. The brain has measurable, structural, and functional abnormalities. In the left image, the ventricles are clearly larger, meaning it puts pressure on other parts of the brain, decreasing brain volume in areas such as the hippocampus. This is the part of the brain that is responsible for regulating emotions and memory. In this image, the hippocampus is actually smaller. The structural change in the brain can explain some of the cognitive symptoms in schizophrenia. Now, the second thing we learn is, since this image is a depiction of twins, we know that schizophrenia is not purely a genetic disorder. Other biological or environmental factors have to play a role as well. Now that we are done talking about the anatomic abnormalities, let us talk about neurotransmitter abnormalities. A very important concept in neurobiology is that the body is all about balance or homeostasis. For example, we will learn that too much or too little of one hormone or neurotransmitter can cause two opposing conditions. For example, too much sugar in the blood causes hyperglycemia, which can lead to diabetes. The opposite condition is too little sugar in the blood causes hypoglycemia or low blood sugar. Another example is if your thyroid is overly stimulated, you tend to feel more anxious and hot, a condition called hyperthyroidism. Now, the opposite, when there is low levels of thyroid hormone, you feel cold and down, a condition called hypothyroidism. But what's the opposite of hallucinations or delusions? What's the opposite of positive symptoms in schizophrenia? Positive symptoms seem to have no normal counterpart in the average brain. That is why understanding psychosis is so interesting. We will begin the discussion on neurotransmitter abnormalities by discussing dopamine. Why dopamine? Well, the first antipsychotic medications that were ever introduced to the market worked by blocking the effects of dopamine, and this really helped with positive symptoms. So this suggests that schizophrenia is caused by increased levels of dopamine in the brain. To explain the role of dopamine in schizophrenia, I will compare it to Parkinson's disease. The reason I'm using this example is because dopamine is present in excess in certain parts of the brain in schizophrenia. Now, in Parkinson's, dopamine is actually depleted. Drugs that we use in schizophrenia that block dopamine can cause Parkinson's-like symptoms. Similarly, drugs that increase or stimulate dopamine, like marijuana, amphetamines, cocaine, they can induce psychosis or what is widely known as a bad trip by recreational drug users. So yes, drugs can cause psychosis. Even marijuana can lead to psychotic symptoms, and the more consistent use can further increase that risk. So it's very important to know the risks before ingesting anything. Now, dopamine is not the only neurotransmitter involved. Medications that regulate dopamine firing are far from perfect. They don't work for everyone and affect different symptoms in different people. Clozapine is arguably one of the most effective antipsychotics on the market. It's reserved for people who are resistant to all other treatments. And this drug has very weak antagonizing effects of dopamine. So this suggests that norepinephrine, serotonin, GABA, and other neurotransmitters are undoubtedly involved. So exactly where in the brain and how can we explain positive and negative symptoms? Let's start with positive symptoms. Positive symptoms like hallucinations and delusions, they're caused by excessive dopamine firing in the mesolimbic pathway. The mesolimbic pathway is essentially a string of neurons that travel from the ventral tegmental area, or VTA, to the nucleus accumbens. The mesolimbic pathway is also known as the reward pathway. It regulates motivation, reinforcement learning, and fear, among other cognitive processes. When someone uses addictive drugs, dopamine neurons in the VTA are activated. These neurons project to the nucleus accumbens via the mesolimbic pathway, leading to an increased level of dopamine in the nucleus accumbens. This is what leads to this elevated sensory state or feeling high. Too much dopamine in this pathway is what is believed to lead to psychotic symptoms or positive symptoms in schizophrenia. Now, what causes negative symptoms? Low dopamine firing in the mesocortical system. The mesocortical system is comprised of neurons that extend from the VTA to the cerebral cortex. But unlike the mesolimbic system, which sees excessive dopamine, low dopamine firing in the mesocortical pathway causes negative symptoms. The mesocortical system is thought to control emotions and cognitive functioning. Now, a depletion of dopamine in this part of the brain is believed to cause the flat affect, low levels of facial expression, and decreased motivation levels. So in the mesolimbic system, there's too much dopamine, and in the mesocortical, there's not enough dopamine. The brain is such a highly intricate biological system. An imbalance in certain parts of the brain can lead to serious illness. These conditions are generally brought on by biological or environmental factors, things we have no control over. However, ingesting chemicals that can dysregulate neurotransmitter function can have similar effects, and in some cases, the damages can be irreversible. So educate yourself.
Okay, so we learned a lot about psychosis and the role of dopamine in positive and negative symptoms. Now let's talk about what the symptoms include. The symptoms include delusions. These are false beliefs that are not based in reality. For example, a person experiencing psychosis may believe that they are being followed or that they have special powers. Hallucinations. These are sensory experiences that are not real. For example, a person experiencing psychosis may hear voices or see things that are not there. Paranoia. This is a feeling of suspicion or distrust of others. Agitation. This is a state of restlessness or anxiety and violence. People experiencing psychosis may become violent or aggressive. All right, now that we've reviewed psychosis and the symptoms and how it comes about, let's talk about severe withdrawal. The main ones I want to focus on is delirium tremens, otherwise known as the DTs, which is a severe form of alcohol withdrawal characterized by confusion, hallucinations, and seizures that requires immediate medical attention. Cardiovascular complications, so withdrawal from certain substances like stimulants or opiates can strain the heart, potentially leading to irregular heartbeat or other issues. And this can require monitoring and medical management. The last one is seizures. They can occur during withdrawal from alcohol, benzodiazepines, or other substances. Medical intervention is crucial. And then some other symptoms, depending on the substance, withdrawal can include anxiety, agitation, tremors, nausea, vomiting, and sweating. But these severe withdrawals, it's really important to understand them because they really do need medical attention if you see the delirium tremens or the seizures. So the next thing is spotting overdose symptoms. Overdose is a life-threatening medical emergency, and recognizing the signs early can save lives. An overdose occurs when a person consumes more of a substance than their body can safely process. This can result from taking a higher dose than usual, using a drug that is more potent than expected, or combining substances such as alcohol or benzodiazepines, which amplify the effects. So here we're going to learn a little bit about alcohol poisoning.
Alcohol poisoning is the name for an alcohol overdose. Of the 95,000 Americans who die each year from alcohol-related causes, 2,000 of them are due to alcohol poisoning. Learning to recognize the symptoms of alcohol poisoning can save a life. How does alcohol kill people? When a person drinks a lot of alcohol, the excess alcohol in their bloodstream can shut down areas of the brain that control the basic functions of the body, like our heartbeat, temperature, and breathing. What does alcohol poisoning look like? Alcohol poisoning resembles a drug overdose. Symptoms of alcohol poisoning include difficulty thinking and remaining conscious, vomiting, difficulty breathing, clammy or cold skin, a slow heart rate, and a dulled response to outside stimulus like saying someone's name or poking them. Alcohol overdoses can cause permanent brain damage. As the saying goes, minutes matter in an overdose. And if you think someone around you is at risk of dying from alcohol poisoning, it's important to take action. How to help someone overdosing on alcohol. The course of action to take depends on if the person's awake or conscious. If they're unresponsive, the first step is to call 911. Stay with them until first responders arrive. After you call 911, turn the person on their side. And this is the recovery position, and it makes it much less likely that they're going to choke if they vomit. Don't leave them alone. And if you know CPR, be prepared to use it. If they're still awake, make sure they stay awake. Also, the only thing that sobers a person up is time. Coffee, water, a hot shower, none of it works. They'll be out of danger when the alcohol is out of their bloodstream. Awake or not, any alcohol overdose is an emergency situation. Medical professionals can use methods like oxygen therapy and IV fluids to help stabilize them. Alcohol poisoning is always a sign of a major alcohol problem. The Edge Treatment Center uses evidence-based, proven methods to treat alcohol abuse effectively. Our program helps people identify and treat.
Okay, so here we learn about alcohol poisoning and what it looks like. It's definitely needed for medical intervention. All right, so let's break down alcohol poisoning a little bit more. The mental signs are confusion or stupor, inability to wake up, unconsciousness. The physical signs are slow or irregular breathing with fewer than 8 breaths per 10 seconds between breaths, vomiting while unconscious or semi-conscious, hypothermia, which is that cold or clammy skin, pale or bluish skin, especially around lips and fingernails. The neurological signs can be seizures, unresponsiveness to pinching or shouting. So, alcohol poisoning can cause life-threatening complications, including respiratory depression, hypothermia, seizures, and severe dehydration, which may lead to brain damage or organ failure. Without immediate medical intervention, such as monitoring vital signs and preventing choking on vomit, it can result in coma or even death. All right, let's talk about stimulant overdose. As we saw in the meth video before, stimulant overdose is rising in America. So the signs are mental agitation, severe anxiety, confusion, or paranoia. Physical, rapid or irregular heartbeat, chest pain, difficulty breathing, profuse sweating, or high body temperature. And neurological, they can have seizures, tremors, dizziness, or loss of consciousness. Once again, stimulant overdose requires immediate attention to prevent complications such as stroke, heart attack, or organ failure. All right, opiate overdose, which is something I'm sure many of you have heard a lot about. So, mental would be confusion, extreme drowsiness, or inability to stay awake. Physical, slow or stopped breathing, pinpoint pupils, which is what I talked about earlier when we were talking about what the signs are of substance use. Blue tinged lips or fingernails, or cold and clammy skin. Neurological would be unresponsiveness, unconsciousness, or choking, gurgling sounds. So, an opiate overdose can lead to severe complications, including respiratory failure, brain damage, aspiration, pneumonia, and cardiac arrest, often caused by oxygen deprivation. So, without immediate intervention, such as naloxone administration and emergency medical care, these complications can result in coma or even death. So, here, let's talk about tools for crisis stabilization. Narcan administration, which is naloxone, is crucial for reversing opioid overdoses. Um, it reverses opioid overdoses by blocking opioids in the brain, quickly restoring breathing and preventing death. The thing to understand about this, though, is that it only does it for about 60 to 90 minutes. So this could work, but it's important to get someone to care right away because they can overdose again if they move out of that 60 or 90 minutes that Narcan works. Another tool for crisis stabilization is a screening tool like the SBIRT, and other brief assessments to quickly evaluate risks and needs. So these guide intervention strategies and referral decisions. So today, we're going to talk about the SBIRT and what it is. So it stands for screening, um, quickly assess the severity of the substance use and identify the appropriate level of treatment. Brief intervention engages individuals in a short, structured conversation about substance use, focuses on increasing awareness and motivating change. And then the RT is the referral to treatment. So connects individuals with further assessment or specialized treatment if needed. So the SBIRT stands for screening, brief intervention, and referral to treatment. It is an evidence-based practice designed to identify, reduce, and prevent problematic substance use. In crisis intervention, the SBIRT identifies individuals at risk, guides immediate conversations, and ensures timely referrals to appropriate care. So the SBIRT, a short, structured conversation about substance use. So number one, the purpose is to raise awareness of substance use risks and motivate positive change. Number two, have a non-judgmental approach. So use a calm, empathetic tone, avoid blame or confrontation. Three, open-ended questions. Encourage dialogue and self-reflection. You could say something like, tell me about your recent substance use, or what changes would you like to see? Provide feedback. So offer supportive observations. This seems to be affecting your health. What do you think? Motivational statements. Highlight strengths and potential for change. You care about your family. How can we build on that? And then last, a call to action. Offer immediate support steps. Consider a counselor or support group. So we're going to do another scenario here. This is about Maria. So here's the background. The mobile crisis unit is dispatched to a rural home after a 911 call from Maria, a 29-year-old woman who reports that her brother, Luis, is experiencing severe withdrawal symptoms. Luis, a 35-year-old with a history of opiate use disorder, had been attempting to detox at home after losing his job and health insurance. Maria explains that Luis has been sweating profusely, shaking, and explaining of severe abdominal pain. She is frightened because Luis has become agitated and refuses to seek medical care, saying, I can handle this myself. I don't need anyone's help. Maria says she feels helpless and unsure of what to do. When the crisis team arrives, they find Luis sitting on the porch, visibly distressed and shaking. The room has scattered pill bottles and signs of neglect, such as empty food containers and discarded blankets. All right, so it seems like Luis is in need of some support. So, what are our objectives um, using the expert? The first one is screening to assess the severity of Luis's substance use and withdrawal symptoms. The second is conduct a brief intervention to engage Luis in a short, structured conversation about his substance use and motivate him to seek help. The third is to provide a referral to treatment that connects Luis with appropriate detox and support services. So, application of the SBIRT. The first step, step one, is the screening, right? So, the team begins by gathering information about Luis's substance use history and symptoms. They ask Luis, we'd like to understand what you've been going through. Can you share how long it's been since your last opioid use? Have you experienced withdrawal symptoms like this before? How did you handle them? They use a brief screening tool to assess his substance use severity. So an example question might be, on a scale of 1 to 10, how difficult has it been to control your opioid use in the past month? They identify immediate risks such as dehydration or severe withdrawal symptoms that may require urgent medical care. So they're doing this screening to see if they need more help and to kind of assess his level of addiction and to look at other immediate risks. So, brief intervention. The team engages Luis in a support, non-judgmental conversation to raise awareness and motivate change. So, first, they acknowledge his experience. You've been going through a lot, and it's clear you're trying your best to manage this on your own. And then they provide feedback. Withdrawal symptoms can become dangerous if not managed in a safe environment. Seeking professional care can help you get through these more comfortably and safely. Then they explore readiness for change. What would make it easier for you to feel comfortable getting help right now? They use motivational interviewing techniques to emphasize Luis's strengths, which we'll go over motivational interviewing in future trainings. It sounds like you're trying to take control of your situation. Seeking support is a powerful step in that direction. So they're looking at this brief intervention by acknowledging his experience, then providing feedback and exploring his readiness for change. So referral to treatment. The team provides Luis with options for immediate care, detox facility. Here's an example of what they could say. We can help arrange for transportation to a nearby detox facility where you'll be in a safe, supervised environment. Or maybe they think medication-assisted treatment might be better. If you're not ready for detox, we can connect you with a clinic that offers MAPs, such as Suboxone, to help ease withdrawal symptoms. So they're trying to find like what does he want to commit to? Because that's very important. They ensure Luis feels involved in the decision-making process. So which of these options feels more manageable for you right now? The team also equips Maria with resources. Here are support groups and family counseling options that can help you navigate this process alongside Luis. So it's important to get the buy-in from the family too and see how you can support them because addiction is a family disease. It's not one person. So the outcome, using the expert, the team successfully engages Luis in discussing his substance use and motivates him to accept help. He agrees to be transported to a detox facility for evaluation. Maria feels reassured by the plan and commits to attending a family support group to better understand addiction and recovery. So this is the best case scenario, right? Debrief discussion. So, how did the screening process help identify Luis's immediate needs? Well, it provided clarity on his substance use patterns and withdrawal severity, ensuring appropriate care was recommended. What strategies made the brief intervention effective? Well, the team's non-judgmental tone, focus on strengths, and motivational interviewing techniques built trust and encouraged engagement. Last, how did the referral to treatment ensure continuity of care? By providing clear, actionable options and involving Luis in the decision-making process, which is really important, the team facilitated a smooth transition to professional support. All right, so that's how we would use the expert in an intervention. So the key points from this training are immediate crisis response. Stabilization services address acute situations such as overdose, withdrawal, or psychosis, as we saw. We always want to do a client-centered approach. So individuals' needs and preferences are paramount in crisis stabilization. Tools for engagement, things like the expert, which is a key tool to assess and address substance use concerns. And then referral and follow up. So connecting individuals to appropriate treatment and support services is essential. All right. Thank you.